Hey, everybody. Welcome to Resiliency Radio, your go-to podcast for the most cutting-edge insights in integrative and functional medicine. I'm your host, Dr. Jill, and with each episode, we dive into the heart of healing and personal transformation. Join me as I interview medical leaders, experts, innovators, and all types of professionals, people with information to help you on your path to optimal performance and longevity, just living your best life. I try to bring information every single week that will help you in your journey. And as you know from listening to my podcast, we interview all kinds and types of people, just bringing the best of information for resilience and optimal performance. Today is a special episode with Dr. Paul Savage from MDLifespan. I am super excited to introduce him and to tell you more about what he has to offer. But before I do, I just want to remind you, number one, Flatiron Functional Medicine, my clinic in Louisville, Colorado, is accepting new patients. Many people don't know that we have two mid-levels that are fabulous. Fawn, who's a physician associate, and Hannah, a certified nurse practitioner. And they are able to prescribe and treat, and they work with me on all the complex chronic cases. I handpick these two. They're spectacular, and we are accepting new patients. So if you're suffering or someone you love and you want to see us in the clinic, just give us a call, 303-993-7910, or you can email info@flatironfunctionalmedicine.com for more information. Secondly, if you need products or services looking for treatment for Epstein-Barr, small intestinal bacterial overgrowth, mold toxicity, or many other things, I have curated products and services for you at drjillhealth.com. Pop on over to drjillhealth.com, get 15% off your first purchase, and check out an array of curated products to help you on your way to optimal health there. And don't forget the Dr. Jill Beauty line, which is been designed by me to be low toxicity and optimal performance. Many people say, what have you done with your face? Well, I actually use these products myself. So you can go to drjillhealth.com for more information on my line of Dr. Jill Beauty products. Okay, let me get back to our introduction. Dr. Paul Savage is a medical doctor, physician, innovator, and founder of MDLifespan, where he serves as chief medical officer and leads the development of the patent-pending PlasmaXchange protocols aimed at reducing environmental toxins, especially mold, and enhancing long-term health. With more than 35 years of clinical experience, Dr. Savage's journey from emergency medicine to personalized and integrative healthcare inspired his breakthrough in longevity and toxic reduction. After transforming his own health through lifestyle medicine, hormone therapy, and regenerative approaches, he has dedicated his career to empowering patients with practical and data-driven solutions and addressing chronic inflammation. Join me now as we answer the top most asked questions by patients. Here's Dr. Paul with MDLifespan. Dr. Paul Savage, you are a colleague and friend and just one of the people in the world of medicine and innovation that I respect so greatly. And I am so excited about this special episode that we're doing today because we're going to dive into something that I now offer in my office in Denver, Boulder, Colorado area, but all over the US and hopefully someday all over the world. Your company, MDLifespan, is providing this total plasma exchange. And a lot of people either have never heard of it or they have a lot of questions about what is this? What does it mean? So today we've taken from your group of patients and from my patients and website all of the most commonly asked questions about total plasma exchange, what it means, and what you need to know if you're trying to make a decision if this is right for you. So stay tuned. I promise you, knowing Paul and me, this is going to be an episode chock full of great information that's really, really practical. So Paul, one of the frames we just started talking about, and then we'll dive right into the questions, is toxic load is something that I deal with as a mold expert every single day. And today's actual title is around mold because I tend to treat the mold toxic, but this involves all toxins. And you're going to dive into some of that details of what are the most important toxins that this can help with and why are our traditional detox methods failing us, why we need something like TPE and the kinds of people who need that. But the one thing I want to mention is the frame we talked about right before we came on. And what that is that when we talk about toxic load, it's scary. People all of a sudden realize they're swimming in toxic soup. And I know when I go out there and lecture even to the physicians, you can actually physically feel in the audience this sense of like overwhelm and doom, right? Because the truth is this exponential increase in toxins. And you and I talked about the free ebook, the free book that you're going to be giving away. So stay tuned for that as well. Because one of the toxicologists, one of the world experts in your book talked about this overwhelm, but then also the fact that we have agency, that we can do something about it, and that we now have these tools like TPE. So let's dive in. Our first question is perfect frame. That is, what is therapeutic plasma exchange and how does it physically remove versus return? Like what's actually removed from your blood? Give us a little bit of 101 on TPE.
Therapeutic plasma exchange is a process that's been around in medicine for over 50 years. This is a old procedure. It's well known. The complications, the process, the benefits, very well documented in the literature. A lot of people don't know about it because it hasn't been the first line therapy of anything. So it's always you have this problem, and finally we need to figure out how to solve it. And plasma exchange offers some alternatives. So plasma exchange is an interesting thing. It's a mechanical process by which we take your blood out. It goes into a machine. The machine separates your blood into two components, the liquid part that we call plasma, and the cellular part, which is your red cells, your white cells, and your platelets. That's all that goes over here is the cells. Everything else is in the plasma. You can think of plasma in the body kind of like a superhighway. It carries everything. It carries your nutrients, your blood sugar, your hormones. It carries your medications. It carries toxins. It carries inflammation. It carries antibodies. Everything else besides the cells are in the plasma. So when we separate the two components and we throw the plasma away, we're throwing out the good, the bad, and the ugly all at once. We recombine those cellular products with a human-derived albumin liquid, and then we infuse it back into the body. During one exchange, we're replacing about 2/3 of your plasma with this human donor albumin. Now, this is a very safe procedure. People do have some concerns. I understand that because the albumin does come from other people's plasma. But this is something that, again, has been around for a very long time. And the process by which they get the albumin out of other people's plasma is known as electrophoresis, where we pass a current through the plasma and only the albumin comes to the one side and we harvest it. And then it's cleaned, and then it's checked, and then it's packaged, and then it's sold. This has been around so long that we went through the HIV era with nobody getting HIV or viruses or cancer or anything else. It's just albumin. When you take the albumin and you put it on an MRI machine, the only spike that you have, there's no other spikes, is the albumin itself. So this is very safe product for people to use. There's other people out there that sometimes give other people's plasma as replacement fluid. And I just want to make sure your audience realizes don't do that.
Yeah.
That doesn't, they promoted it as, we're giving you a young man's or a young woman's plasma, it's going to be good for you. There's nothing in that plasma that your body can't make. Okay. But there are a lot of reactions that you can have when you get another person's blood products. And those are called transfusion reactions, which is very dangerous and can actually lead to death. But with albumin, there's very minimal side effects. The real side effects that come from this kind of procedure is usually bruising where the IV came from, or the blood sugar may go a little bit low because we're taking everything out, including your blood sugar, or your volume, your blood pressure may go down a little bit. That we see that more in people who are on medicines for blood pressure. It doesn't happen very often. Or they can actually have a problem with calcium because when the blood goes through the machine, we have to add a natural chemical called citrate. Citrate grabs your calcium in your plasma or in your blood, and it keeps your blood from clotting while it's in the machine. But we give you back the calcium with the albumin as it's coming back to you, so we don't see that reaction very often. And on a very rare occasion, in 3 years after doing thousands of plasma exchanges, we've only had 2 people have an actual allergic reaction to the citrate. But I'm an old ER doctor, and there's a lot of different levels of reactions to this. And this kind of reaction, you break out in a rash, your blood pressure may go down a little bit, you may get a little sweaty, you may feel a little lightheaded, but we lay you back, we give you some fluids. And the nice thing about this is citrate is very rapidly cleared from the body. So within about 20 minutes, you're doing fine and you go home. In all the time that we've been doing plasma exchange in all the MDLifespan offices, we haven't had a single patient have to go to the hospital or follow up with their doctor. They do very well.
Well, thanks for explaining that so clearly because that's exactly, I get a lot of patients who are asking about
Yeah,
it and asking questions, and that's the exact thing they're concerned. But the truth is, albumin is our universal binder. So this is a
it
wonderful
is.
product to
That's
give back. Like it is the best thing you could possibly do. So
correct.
right? You did a
I
really,
mean, when you're looking at toxins, you're trying to get toxins
yeah,
out, albumin acts as the sponge that
yes.
goes into your body and grabs more toxins by giving you just pure human albumin, which is identical to everybody's albumin is absolutely identical. So your body doesn't know it's not yours. It just treats it like albumin. And albumin binds all these toxins. So the next time we're ready to do another plasma change, we get even more out the next time.
Makes so much sense. Now, I often lecture on total toxic load, and what I talk about is my little way of thinking about it, which is we are getting this tissue load of toxins as we inhale, as we ingest, as we be in the world through our skin, through our respiratory system. And those toxins typically are lipid soluble, which means they go into our tissues. So most people are walking around with a tissue burden of toxic load. Now, there's an equilibrium, and I'll let you talk more about this between the tissue load and the plasma or the serum load. But in my mind, we always are talking about mobilizing those toxins from the tissues into the serum. And then in my mind, when we're not doing TPE, which is the amazing thing here that we have this next level of detox, we're just using binders or things to filter that blood and to bring that toxic load out. So we mobilize and then we eliminate. How does TPE differ from that traditional model in the sense of what things are you taking? You said plasma, but is this like, is there immune complexes? Is it metals that are in the blood? Is it mycotoxins in the blood? What are we actually taking out of the blood? What are we filtering? And could we be filtering some of the inflammatory compounds, not just the toxins?
So the process, the interesting thing about plasma exchange. Now, you and I have been around the world long enough to remember all the things we used before, infrared sauna,
Yeah.
binders,
Mhm.
chelators. I mean, there's a lot of different things that we've used. The problem with those things is you have to give that to a person, and then that brings the stuff out. So, I
Exactly.
mean, you give them heat, and and their pores,
So,
it comes
Paul,
out
let
of
me
their
really,
pores.
really quick clarify because this is so important. I want people to get what
Yeah,
you're saying. And then the mobilization, all of those things that we have in the past, they mobilize out of the tissues into the blood. And I find
right,
people often get worse before they get better because
correct,
unless you're eliminating well, and if they have
correct,
impairment in stool, like constipation, or their kidneys aren't working, or their liver's
right,
not working, or whatever toxic load, they can
right,
mobilize all day long and they're not getting rid of it. So go back
correct.
to what you were saying and why this is so much more important on the elimination side.
Right, because all the things we used before depend upon those things mobilizing the toxins from everywhere out of the tissue
Yes.
into the plasma. And you have to have a detox pathway that's available to eliminate it. The kidneys, the liver, the skin, the stool. That's how it has to come out. Plasma exchange is completely different because it's a mechanical process.
Mhm.
We're literally taking your blood out, separating it, throwing it away, giving you a backup human. It doesn't depend on any of your genes, your kidney, your liver, your skin, your colon. It's going direct. So we're not giving you anything. We're literally taking it out.
I love that because it's so simple. I mean, like you said,
Yeah.
this has been around 50 years, and this is
Yep.
not a new technology. People think it
Yep.
is. And it actually has a very long history of safety and efficacy, which is also
Yes.
why it's so powerful. So, Paul, one of the things that we see is we're obviously mold related patients. This is a really big deal. And in my practice, and even the title of our talk today is around mold because I know my listeners, my audience is all about mold. And we'll talk about later because we have a special mold protocol that I helped create with MDLifespan. But what I want to talk about next is who benefits. Obviously, the mold, you can talk about them, but what kinds of patients most benefit from this procedure? Give me just a list
Yeah.
of like the best candidates.
So, as we talked before, not everybody needs TPE. Everybody needs to learn how to minimize your toxic exposure in your environment. And that's not difficult. That's what we're going to be talking about in the book that's going to be published here within a very short period of time. And everybody needs to check their toxin levels because you don't know what you don't measure. And everybody has every kind of toxin. There is nobody in the US that doesn't is toxin free. There just isn't. Now, we talk about the mold patients, and frequently I get people in from you and from all over the country because we have a very effective way of treating it with plasma exchange. But I also want to make clear to them, you're not just mold toxic, you're everything toxic, including mold.
Yep.
Everybody is. Because back in the day, 10, 15 years ago, we'd really focus on mold because everybody still had a lot of toxins. But if you could bring one of the silos down, like the mold, you could reduce the total burden significantly enough that people would get better. Same thing with chelation. You could reduce some of the metals far enough that people would get better. Or infrared sauna, you could reduce a lot of the volatile chemicals and the phenols by that way. And just because the total toxic burden came down, the total toxic load came down, their body was able to resume a very relatively good mechanism of feeling well. Unfortunately, today there's just a lot more toxins out there, and not only in the number of different toxins, but the amount of each of those toxins in the environment. So when we start, which patients do the best? Well, mostly when we're looking at plasma exchange for patients, what I'm looking at is a couple different factors. Number one, symptomatology. The people who are sick already have enough toxins. I don't need the test to tell me they have too many toxins because their body is telling us already from their symptomatology that they're toxic overloaded. We can even see that in the blood test when we look at the lymphocytes in the immune system, or the inflammation, or the oxidation, or even the binding proteins go up, because many of these binding proteins that your body makes naturally for things like, let's say, estrogen or testosterone, they bind mold. And that's why the body produces more of it, because it's another way of hiding it. The only defense the body has against every kind of toxin, including mold, heavy metals, environmentals, is to either get rid of it, hide it, or bind it. That's one of the three things has to happen. So the nice thing about plasma exchange is you're mechanically removing all of these toxins, which doesn't depend on any of these mechanisms at all. So the people that really have benefited the most from our protocols are the people who are symptomatic. Then on the backside, we do lab testing, which a lot of places don't. We do toxin testing. We look at their immune system because we want to show people at the end how much they improve, not only symptomatology wise from their symptoms, but their numbers, so they can see that they've made progress. And we have a very incredible track record of almost 100% that people are getting, having the result that they want. Now, with that being said, our company isn't just out to sell TP to everybody. So there's probably a third of the time I tell people, maybe you should go see Dr. Carnahan, or maybe you should go see a functional medicine doctor. Maybe you should, I think if you did infrared saunas and binders, that may be sufficient for you, because plasma exchange is not an inexpensive process, but it does work for those patients who've been the gambit and they've done everything, or the patients who are so sick that they don't have the time to do the binders and the chelators, because the sicker they get, the harder those mechanisms are to use. As you and I both know, the sickest of the sick people, every time you give them a little bit of a binder or a little bit of a chelator or a little bit of, they just, what we call hercs, they just don't feel well. They get fevers, it mobilizes it too quick, it overwhelms the system, and the immune system runs amok. We don't have that problem with plasma exchange because, again, we're not giving you anything. We're just taking things away.
Paul, that was so concisely and well said. And just from my clinical experience, I wanted to add that a lot of patients, just like you said, first thing is when I see this total toxic load, we do some of the same testing for that. And if I
Right.
see a lot of mold, automatically I will also see a lot of metals and chemicals and parabens and phthalates and PFAOs and microplastics, because mold by nature really trashes the glutathione system. So it's this double whammy of not only there's this toxic load from mold, but it actually impairs your ability to detox. So they get really stuck in a loop. And then I love this. We've talked about it a couple of times, but I think it's so important. This mobilization idea is sometimes super toxic to a patient, because if their routes of elimination, their lymphatic drainage or their kidneys or the liver are impaired or overloaded already, I feel like clinically with the old protocols, we get stuck because the tiniest bit of mobilization makes them so sick because they can't eliminate. And again, I just want to reiterate this point because TP bypasses that issue that I see clinically that has probably for 25 to 50% of my patients kept us stuck. And then the other thing is, if I see a patient for the first time and we know there's mold toxicity, I am telling them in clinic, this is going to take a minimum of 6 months and many times up to 18 months or longer. And like you said, this is a much quicker process that can get them to the same point.
Yeah. I think you bring a really good point for patients to really kind of grasp here is that it's not just about mobilizing it from the tissue. Once you mobilize it from the tissue, and let's say it gets into the plasma, which it has to get into, or the lymphatics to get to the organs that push them out. If those organs are overwhelmed and that lymphatic and plasma is already overwhelmed, mobilizing more toxin is
Yes.
harmful. Your body, it literally your body goes, I put them away, I hid them away so that I can manage, and now you're dumping these things all back on me, and that's why people crash. The difference with plasma exchange is we're not mobilizing right away. We're coming in and we're taking out the plasma, giving you back albumin. You make brand new, fresh Jill Carnahan plasma within 24 hours, which is much more dilute in the toxin load than it was previously. And now the important part here for people to understand is you have to wait a certain amount of time for the tissues to gently release those toxins back into the plasma because the body goes to equilibrium. So if you have now the load is shifted that it's mostly in the tissue and it's not in the plasma over the course of a month, and you need a month, and I'll explain why, the tissues mobilize it into the plasma. And even if your kidneys and liver and colon and skin aren't eliminating any of it, it's not overwhelming the system because it's this gentle transition from one area to another.
Hey guys, just a quick interruption to remind you there are so many more people out there that are suffering from mold toxicity, autoimmunity, and complex chronic illness. I hear your stories and the suffering every day. I just wanted you to know that at our office in Louisville, Colorado, Flatiron Functional Medicine, we are accepting new patients. Many people don't know that I still see patients in clinic, and I have two mid-level providers that are absolutely spectacular, Fawn and Hannah, and are accepting patients, and they work directly with me. So if you are suffering or someone that you love from a complex chronic illness, please give us a call, 303-993-7910 to schedule. Okay, let's get back to our show. It's literally a mathematical equation of equilibrium. And that's what's so beautiful is you're pulling out, giving room for it to pull out of the tissues again. So naturally, your body's just going to keep mobilizing. And this is granted, you and I, we'll talk in a little bit about toxin avoidance and other things you can do. But even if someone were to not be able to do sauna or not be able to do a lot of the other things, they would still benefit because
they do well with TPE because we don't depend on mobilization before extraction. We extract and then let the body mobilize afterwards when its load is less. The important thing that people need to understand is nobody knew 3 years ago how frequently the TPE should be done. Historically, and many of the places still do this, they do 6 TPEs in 2 months or 2 weeks. The reason they do 6 TPEs in 2 weeks is historically plasma exchange was used to extract antibodies and immune complexes, and those are mostly in the plasma. They're not in the tissue. So you could do 1, 2, 3, 4, 5, 6 in a row, and you're bringing that immune complex and antibody level down relatively quickly, and the body doesn't mind that. But if you're doing toxin extraction, what we did is we measured the toxin loads. We did a plasma exchange on a group of patients, and then we measured their toxin loads at 1, 2, 3, 4, 5, and 6 weeks afterwards to find out what the pathway where the toxin was. Interestingly enough, many of the toxins return within the first week or 10 days. Metals, phenols, the things that mobilize relatively quickly. But as you mentioned, the toxins that are stored in the fat, the microplastics, the mold, the PFAs, and the pesticides, herbicides, they take over 3 weeks before they mobilize to an equilibrium where we don't see any more increase in those numbers. So wherever you go to get plasma exchange, if you're doing it for mold toxic or for any kind of toxicity on the chronic toxins that people have obtained, don't do them closer than a month apart because plasma exchange is expensive. If you're going to use it where you're going to get the most benefit. That's why we don't do that's why we do a plasma exchange once a month for a series of 3, or in mold patients, almost always 5, because again, the toxins, there's a lot of toxins in the universe. There's more and more we invent more and more every year, and we're putting more of the ones we've had before. But that doesn't mean that every toxin is as dangerous as the other toxin or as easy to get out. When we're looking at the ones that are difficult to extract, you're looking at mold, you're looking at plastic, you're looking at pesticides, and you're looking at PFAs, partly because the way the body gets rid of them or hides them is to put them in fat cells.
Yeah.
Other cells, it may be the bone, it may be the muscle, it may be the tissues, and those come out relatively quickly. But those ones I mentioned, they take time.
Yeah, that's so clear. And I love bringing clarity to this because I think people listening, I'm sure, are already understanding the power of what we're talking about.
Right.
One thing I want to talk about before we go to mold specifically is contraindications. Is there any kind of patient that would be contraindicated from doing this, medical red flags or age limitations?
So plasma exchange, again, is a very safe procedure. But, and this is an MDLifespan thing. This isn't every other clinic out there. We're doing it as an outpatient setting. So many of these outpatient places that are offering TPE, literally you go in, it's up on the billboard, you can order TPE, they bring you over, they sit you down, they do a TPE. That is incredibly dangerous. There are certain patients that you need to be very cautious at doing. Let's run through a couple of them. Anybody who is not able to cooperate with the procedure because they're confused, let's say moderate Alzheimer's and autistic, you have to sit still for 4 hours and you have to be able to follow commands. Patients that take certain medications, that if their medications go low, because remember,
Yes.
plasma exchange takes out everything, including the medication. So if they have issues with seizures, where if they mess with their levels a little bit,
Yeah.
they're going to have a seizure. Or they're very bad asthmatics. When you mess with the levels, you send them into asthma or congestive heart failure or what we call ventricular arrhythmia, where you're on medicine to control the heart from having those deadly arrhythmias. This is not people you want to do plasma exchange on in an outpatient basis. This is somebody you want to do plasma exchange on in a hospital setting. Whereas if you have a complication, you know what to do about it. We don't do it on pregnant women just because, although it's safe, this is outpatient procedure. We don't do it on people under 18, and that's mostly because malpractice excludes anybody under 18. I mean, it's again one of those things. Kids have a different set of parameters that go along with that. And also, anybody that's had a major event, a heart attack, a stroke, or congestive heart failure within 6 months, we will wait 6 months and then we want a clearance from the cardiologist or the neurologist before we do it. Not that plasma exchange is dangerous in those people, but simply put, those patients who've had a heart attack or stroke or congestive heart failure are at a higher risk of having another one within 3 to 6 months. So we want to make sure you're well outside that window because this is an elective procedure for people to do.
Oh, Dr. Savage, that's so clear. And I love that because as we talked in the beginning, you're doing this. The MD Lifespan is in my office in Louisville,
Right.
Colorado. And it's so exciting to walk down the hall and see people benefiting from this. Your team is amazing, your nursing staff. Like what you've done is take something that could be super complex or in the wrong environment with the wrong equipment, potentially dangerous. And I feel so safe having it in my office. And your team is literally extraordinary. You and I talked about that too, like the way you do patient care, it really matters. And that's one of my
It
favorite things
does.
about working with you is it really, the
It
patients love
does.
the team. They love that. We love having your nurse there and it is spectacular.
MDLifespan is owned by and operated by medical people.
Mhm.
We're all doctors. And so we all believe that the patient safety and the patient experience is number one. I have to put a shout out to all of our nurses that we hire. They are incredible, and they really are incredible. Let me tell you why. They have at least 10 years experience in ICU or ER and
Wow.
on the IV team of a hospital. This is the team they call when nobody else can get an IV. All of our nurses have at least 5 years of experience in ultrasound guided IV insertion. We haven't missed an IV, nor do we poke you 6 times trying to find an IV, even on the most complicated people by using ultrasounds. I mean, I think we're at the 94 percentile now on getting it on the first attempt.
Wow.
All of our nurses are certified as TPE technicians. All of our nurses have completed the University of South Florida personalized medicine program. All of our nurses are ACLS and BLS certified, and we go through patient care scenarios once a month where we run all the different events that could happen. So all of our nurses are very well prepared in every one of the office. I'm very proud of our nursing staff, and patients compliment them on their exit interview. I always ask them, how was your experience? And they always comment, the nurses were
Yeah.
fantastic, and they really are.
Well, I'm so glad we talked. That wasn't a planned question, but I love saying that because that's my experience. I mean, we have your team in our office several times a month, and we all love them, and it's just so
Yeah.
easy. So it's really special that you created an incredibly safe protocol to hire as well.
I used to be one of the docs at the largest trauma center in the world for 10 years. And I ran the ER with my nurses. I know the value of having high quality nurses to work for me. I
Yeah.
mean, it makes my life better. It makes the patient's experience the best.
Yeah. Well, thanks for doing that because not everyone out there is that detailed on what matters. So back to
Yeah.
mold. I said we'd come back to this. One thing, and this will lead up to your book that's coming out that it's free for if you're listening out there, stay tuned. We'll talk about that. But for those who are in a moldy environment, so they are living in a building or a home or a place with mold, and they're like, oh, I want to do TPE. What should I do? Does it make sense to do TPE while they're still being exposed, or should they wait or eliminate the exposure first?
Always recommend patients do the avoidance therapy first
Yeah.
because rule number one of detox is don't put them back in. We will get them out. It's not a matter of if, it's just a matter of how many plasma exchanges do you need to have. The reason I say that is we've proven it on thousands of patients. The numbers go down. But some patients are more resistant than others. Also, we should talk a little bit about what we've added to the TPE that makes that even more effective because our protocol, which we call advanced serial TPE, combines not only avoidance therapy teaching, but nutrients along with the TPE timing. And we actually got an international patent on that because it was so effective. But what you're saying is very true. Frequently, we'll get people in and they may be mold patients or other toxicity patients. And we've identified what they're not doing yet on the avoidance therapy. And I always tell them, spend your money there first because you need to have an environment that you're safe to return to after we get the toxins out. We have had patients who didn't do that. And when they did their follow-up testing a year, some of their toxins had come back up. And it was directly related to, did you do what we told you about the mold, for example? Did you get a dehumidifier? Do you have a HEPA filter? Do you make sure that you're cleaning your food properly and buying the right food? Do you have, all these things with water filters and food storage to make sure that you're buying the best food possible? Do those things first
Yeah.
before you come get the plasma exchange. We want the plasma exchange to be a one and done. When you're done with the protocol, if you're following the avoidance therapy, 3 years later into this, we haven't had a single patient that needed to repeat the protocol, but they all have to do the avoidance therapy.
Yeah, that's a really good point, and that leads into our next question. So you just said basically 3 years later. So what my question originally as a doc that didn't understand this, and we've talked about this, would have been was, oh, you get it down in 6 months after 5 or 6 treatments, but does it stay down? And the truth is, yes, it does.
Yes, it
So my
does.
next question, which is one of the stats that you talk about, is what does the claim of removing up to 90% of circulating toxin actually mean?
I'm sorry, I didn't hear the question.
What does the claim of removing up to 90% of
Ah,
circulating toxins actually mean?
so when you're looking at toxins, let me be real clear here. Our goal isn't to bring all your toxin levels to zero.
Yeah.
That's not it is obtainable, but you would have to do a lot of TPEs in order to do that. Our goal is to reduce your toxic load enough where you feel better, your immune system's responding, the inflammation's going down, the oxidation's going down, and we see your toxins have decreased. And generally on the quantity, it's down between 40 and 60% of the total number that were in the upper ranges. So the 90%, when we say we remove, let's say 83% of plastics, of uh, microplastics. What we mean by that is we're getting you down to what's the lowest level that we can measure. For the mold, for example, there are different ranges. There's the range when people, as you explained many, many times when they're doing the mold testing, this isn't the range of safe for you, kind of bad for you, and really bad for you. But this ranges that we have is you compared to every other American
Yeah.
and what those ranges are. And the way we do it is called a survey range.
Mhm.
So the government measures these numbers on a whole bunch of people every 2 years. And the number on which the upper 5% are above, that's the number for the red, and the number above which 75 or the 25 5% of the people are above, that's the other number. What we've seen over 3 years is we get those near the 75 marker, and most people's toxic burden is low enough that they can start mobilizing and doing it themselves, and they don't need further TPE. So when we say we have a 95% reduction, we mean from wherever they were, we're down very close to that 75% border.
Oh, that makes so much sense. And this is always what I'm teaching is this total toxic load. And when you fill up your bucket, whatever that is, some people have small or large capacities and start to
Right.
spill over, you have symptoms. And what you're doing with TPE is bringing that water level down so that their body naturally can kick in and do what we're made to do, which is we detox, that we,
So in the bucket analogy, it's kind of like you have a bucket that gets filled and filled and filled, and finally it
yeah,
overflows on the top. We want to bring that load down so it's about 25% under the top.
yeah,
And that seems to be a level that most people's body can manage. Now, with that being said, we have had a couple patients where we've got their toxin load down, but they're still symptomatic. We do a couple more TPEs because on those people,
yeah.
maybe they need a 50% level. And so in that way, we never know going in, but we're pretty good at this point on telling people you're probably going to do 5, you're probably going to do 3.
Yeah.
On a rare occasion, we've had to do 8, but we knew those from the beginning usually because we're like, yeah, we'll do 5 and we'll remeasure. That's another important thing about measuring before and afterwards, because it's not just that the patient feels better, that's important, but we want to make sure the body is responding in a way that the clinician who's going to follow them after us can monitor those numbers and make sure they continue to improve. Because not only do we see the toxin levels come down 3 years later, but we see the immune system increasingly get stronger. And in the cases, it gets less confused, it becomes less erratic, inflammation maintains down, oxidation maintains down, telomeres get longer, cancer markers go down, Alzheimer markers go down. And so we want to make sure that people are continuing forward. A lot of it is about their symptoms, but a lot of it helps with clinicians. We should be able to monitor those levels. And if they start heading back up, you can intercede before you have to come back for TPE, which is what we've seen in the majority of the patients. That most, what it usually is, honest Joe, is they moved into a moldy house. I
Yes.
had a patient who was very sick, and I don't think it was one they referred, but it was one of the patients that had just a lot of mold. We did the protocol. They did fantastic. Their swelling in their face went down. Their fatigue went away. Their anxiety went away. Their problems with their gut went away. And they did well for about 2 years. And then they called up, they did another test, and I got on the phone with them. I got on the video with them. I'm like, what happened here? And they goes, you know, I walked into this new house and I could smell it. I could smell it when I walked in because I think mold people are hypersensitive to the
Yeah.
smell of mold in many of the cases. He goes, but I stayed there for about 9 months and then they started not feeling good and they're back. And so it's kind of always interesting stories hearing from the
You can always kind
patients.
of find where it went wrong.
Yeah,
Okay, so let's talk a few practical questions. What's a typical treatment day look like for the patient, like time commitment, recovery? Just
sure.
walk us through, like, say they're scheduled at, 9 a.m. on a Monday. What would that look like for them?
So what it looks like is they get a phone call the night before. Because one of the reasons we have a lot lower, we have a third of the adverse reactions that are reported nationally because we prep the patient very well before they come in. We want you to eat a good breakfast because blood sugar goes low, but if you got food on your stomach, we're not going to see it nearly as much. We want them to be well hydrated. We want them to not take certain medications and supplements the morning of the test. So because we're just going to take them
Yeah.
right back out again with TPE, but also if they're on blood pressure medicines, that may cause us an issue that may increase the risk for the. So we prep them the night before. When they come in the day, they're greeted by our friendly nurses. They're brought into the room on the first time that they're getting TP. There might be some papers to sign, some questionnaires to fill out. But typically what we do is we do a weight on them. We poke their finger to get what's called a hematocrit, or the concentration of your blood, by which we can calculate how much plasma you have. And by that, we can determine how much we're going to remove. Then we sit you in a chair and the nurse talks you through the insertion of the two IVs. Typically, it's one in each arm because they go in one arm and out one arm and in the other. And typically, you're in this very comfortable chair, squeezing these rubber balls. You have some tourniquets on your arms, and then we turn the machine on. And the machine typically lasts for about 90 to 120 minutes, about an hour and a half to 2 hours, to do a full cycle where we're just constantly taking out your plasma and replacing it with this albumin. After that time, with our protocols, we're giving you an infusion of nutrients. Remember, Plasma exchange takes out everything, good, bad, and ugly. Why we got the IV? Let's give you back some electrolytes. Let's give you back some vitamins. Let's give you back things that your body's going to need to start detoxing in the time in between treatments. One of the things you cover very, very well, when people are toxic, it displaces many nutrients in the body. So people who are toxic are already by nature nutrient deficient. So not only is the plasma exchange taking out more of those nutrients, but the toxins have already displaced a lot of those nutrients like magnesium, zinc, B vitamins, because you run through it with all the stress that you have. So we take the opportunity to infuse the IVs there. Then we talk to the patient about any kind of medications or any kind of protocols they're going to be doing in between the treatments. And that may include the supplement that we put together with your help, which has 65 different supplements in it. All these things are anti-inflammatory, antioxidants, detoxification, mitochondrial support, and energizers, because this is an opportunity to start replenishing the body in between the treatments so your body can start to heal. We also use, in some cases, we might use a binder, we might use phosphatidylcholine, we might use low-dose naltrexone, we might use DMSA, and we might even use some regenerative products to help speed the tissue's healing in the cases of those patients that have some cognitive issues, or they have heart issues, or they have immune system issues, because the immune system is a system that needs healing as well. And that also includes the mold patients, because mold destroys every
Everything,
tissue.
right? It affects enzymes and affects,
Yeah.
yeah. And I really enjoyed helping work with MDLifespan to be part of that mold protocol. So it has my stamp of
Yep.
approval on it, which is such a
And
delight.
it's one of my favorite protocols.
Yeah.
I mean, we have protocols that treat heart and brain, and women who want to get pregnant want to reduce their toxic load. We have protocols that treat autoimmune diseases and the immune system. But the mold toxin protocol, it's so pleasing because these people come in and it really is spectacular to not watch just them get better, but their numbers get better, and knowing we've actually done something for these patients that have suffered so long and have been so difficult as clinicians for us to treat, because every time we try to do any little thing with them, they respond.
Yeah.
And not in a good way, they react.
Exactly. That's what's been so amazing with partnering and just your ethic and integrity and how you do it. Two more questions. We'll make these last ones kind of quick. The first one is just people out there may have heard of inosphoresis or EBO or some of these other things.
Yeah,
Can you differentiate just a little bit between what your plasma exchange does and some of these other things they
sure.
might have heard about?
Sure. Let's start with immunophoresis. Immunophoresis is close to plasma exchange. It's not available in the US. It's available in Europe and in the Asian countries. I don't know if it's going to be available in the US. The difference between immunophoresis and plasma exchange is immunophoresis is often called the more gentle phoresis, because what they do is the blood comes out, it separates the plasma from the red blood cells. Then they filter the plasma through a filter, and then the filtered plasma, not albumin, is added back to your cells and reinfused. The benefit is you're not using albumin. Now, that may be a benefit or a downside because albumin acts like a sponge, so
Yeah.
that can be debatable. But the one thing that's clear is the filter is not going to remove as many toxins as throwing everything away. So but the effectiveness of plasma exchange in removing environmental toxins, mold, is much more efficient in one plasma exchange than it is one immunophoresis exchange. Now, you could do 3 or 4 and get the same effect as you get with TP. We don't know those numbers yet because there have not been any comparative studies. Because again, the idea of using plasmapheresis to remove environmental toxins, including mold, is new. I mean, we figured that out 3 years ago, you and I and the group I'm with. Everybody now talks about, look at how much toxins that we pulled out. And I keep reminding everybody, we're the one that put that together. Before that, people were using it because they thought they were removing some magical particle and that was making people younger. But the fact is they were removing toxins.
Yeah.
EBOO, now that's a very effective, that's extracorporeal blood ozone therapy. That's a very effective procedure by which you take the blood out and you add ozone, which is O3, to the bag or to the blood as it's out. Ozone is oxidation.
Yes.
It burns everything. That's what oxygenation is. When we talk about oxidative stress, we're talking about things that burn other things. And when you add ozone to a bag, the red blood cells and the other cells, they can manage the oxidative stress. But things like Lyme and viruses and some of the toxins break down because of the ozone. And then you do a little bit of a filter, but then basically you're introducing most of this back into the body and hoping the body can get rid of the debris. Plus, you're hoping that it can manage this extra oxidative load, which is significant
Yes.
that you're giving to people, which is why EBU on mold patients is very hard because you just do a little bit and they start reacting because their oxidative pathways are maxed. And now you're adding this huge oxidative load. And it's just, again, for getting the toxins out, it's not as effective as plasma exchange. So there is a place for EBU. I like it a lot after we get the toxins out with people who still have Lyme and viruses. Yeah, let's go do EBU at this point, but we've already got the toxins out. So we've unloaded most of the oxidative stress. So you can handle this oxidative load now. So there's marked differences, but there's places for each one of these things.
Yeah, I love that you said that because personally, I have some snips around taking care of ROS. I have multiple very strange genetics that make any sort of oxidative stress or even hyperbaric treatment for me
Right.
an increase in ROS, which sometimes when I'm not in a great state, my body can't handle. And I see that in my patients. So I really love that we clarified because a lot of people are out there getting, told they should do this and this and this. And not everything is good for every person. And so I think it's important that a lot of my patients are like me and that they're extra sensitive to that load of oxidative stress. And oxygen seems benign, but people can die of too much oxygen. So it's actually,
Oxidation's
yeah.
great to use
Mhm.
if you're using it on the right
Yeah,
person for the right process at the right time. Like you
exactly.
said, you got all these
Yeah,
TPE, we have the exclusion factors we use, but as long as, and that's not a lot of people that we exclude. Most people can do TPE. It's relatively safe for these people. Again, the difference is I'm not giving you anything like we do with EBO where I'm giving you ozone. I'm just taking things away. We're just removing them and substituting with albumin. So it's just an exchange. I always pretty well known for saying, I start up by saying, it's the oil change for humans.
yes,
That's what
right.
TPE is. We're giving you an oil change where you can think of the IV and the oral supplements as the air for the tire, the gas for the tank, and the spark for the plug. So we're accelerating the healing process by including our patented protocol together, which we made. Then once we had our patented protocol, you and I got together and we put together extra things onto it,
Yes,
which are very effective for the mold patients, including adding a binder, adding a chelator, adding phosphatidylcholine, adding nasal sprays that help with the Marcans and the nasal mold colonization because the TPE removes mold toxins, but you still have to kill the mold
it's
at the
the
same time. I mean,
colonizing.
that's why we always, at MDLifespan, we are not your functional medicine long-term provider. We are the TPE experts. Functional medicine doctors like you send us your
Yes,
patients. We clean them out. We send them back to you. Now the things that you couldn't use before, you can
yeah.
works much, and they're much further down the pathway than where they started. But patients need to follow up with their primary care doctor or a functional medicine doctor afterwards because there's more to do. I always tell people, well, our protocol isn't the end of being sick, it's the beginning of being better.
Yeah, that's so well put. Last question, and what people may have been also waiting for is what are the financial implications for? I know you have multiple protocols and a range, but give us just a little outline on what people may expect with the finances of paying for TPE.
Sure, sure. So looking across the country at Plasma Exchange, you're going to find costs between $4,500 and $10,000 just for the Plasma Exchange. Unfortunately, it's still relatively expensive. The machine's very expensive. The parts are very expensive. The training's very expensive. It's just one of those things. It is an expensive procedure. So if you go into any different place and order 5 TPEs, you're probably looking at somewhere between $36,000 and $50,000 for 5 TPEs. And if you're a mold patient, you're probably looking at 5 TPEs, especially if you're a symptomatic
Yeah.
mold patient who wants to get better, you're probably looking at 5 TPEs. But what we do at MD Lifespan is we take that TPE and we add in all the labs, all the doctor visits, all the IVs, both oral and nutrient, all the medications we're using, and we wrap it into a package price. So if you're looking for 3 TPEs from us with our toxic protocol, you're looking about $23,000. Now, if it were anywhere else, it'd be $23,000 just for the TPE, not including all the other things and having a doctor assigned to your case. If you're looking for the mold protocol, we're looking at $40,000. But again, this is not just the
Yeah.
5 TPEs, but it's all the other stuff that you're getting with it. And then we have what we call the mold plus protocol, because many of the patients have sustained damage to their tissues, especially the ones that are symptomatic that we see. There is an increase in cost of $8,000 where we give regenerative therapies to patients at this time to help accelerate the healing process. And that work now, the people who don't do the regenerative therapies, they still improve. The patients that do the regenerative therapy improve quicker.
Yeah. What a great, oh my gosh, this was so fun, Dr. Fall. And lastly, now people are probably wondering, okay, what about if I want to know more, whatever. I want to just state this, and then I want to have you talk about this Avoiding Toxins book that you've offered to put on our landing page free for people who want to know more. So first of all, if you want to know more, MDLifespan offers a free consult with one of their
Right.
doctors for 30 minutes. So there is no obligation. I know you guys are so great.
Actually, there's 2 appointments for free. The
Wow.
first appointment is to just make sure you qualify.
Yes.
We don't want to waste your time. We don't want to have our time by somebody that's not
Yeah.
qualified or isn't aware of the price point. We're very clear up front to make sure
Yeah.
that we want to move you into an appointment with the doctor. The
Perfect.
first appointment to it's called the patient information call, is where you're talking to one of our providers, and we're just going through a list to make sure you understand the price, you have an issue that we can go ahead and work with, and that you're not excluded from any of those
Yeah.
criteria I talked about. At that point, you move into an evaluation where you fill out a questionnaire. You can upload all your labs. Our doctors look at all of these well before your appointment. They always come to these appointments well prepared, and that's an hour with our provider.
Wow.
Again, there is no charge for that appointment either. We only charge if you sign up for a protocol. So we just want to make sure people get good information. And even if they're not working with us, we're happy to see them to tell them what we do differently than other things or than other places, and why the other places should be following suit with us.
Yeah.
Then there comes the part where this book that we put together. It's been a challenge over the last 30 years of working with toxicities. You've done a wonderful job at writing a book on how to avoid mold and what you need to do in your environment. But we kind of went past that. We needed to go past that. And I enlisted the aid of a very well-known clinical toxicologist, an environmental toxicologist, a mold toxicologist, and a public health degree in toxicology. We got all these people together and we sat down and we wrote a book about how you can reduce your toxic exposure in a safe, non-fear-based methods. We give you the science, and we tell you the science when we know it. We tell you the science when we don't know it. But we also give you various different product lines that conform to what we're suggesting that people use. We're not saying that we're comprehensive of every good product out there, but when people come to us and they're like, what kind of air filter should I get? Something like this. And we
Yeah.
want to give them examples. So this is a very well-written book by a lot of very smart people. As far as we know, it's the most modern example and the only example of something that's comprehensive in the whole environment. We know this works because we have 3 years of evidence on patients who have had the plasma exchange and have followed this avoidance protocol, and their levels today are lower than what they were when we finished the protocol 3 years ago. So if it works on them, it will work for you on keeping your toxic level down, if not even reducing it, because the biggest thing is it's like that bathtub again. If you keep pouring the water in faster than you're pouring the water out, eventually you're going to overflow the bathtub. Our goal is to turn down the spigot so the flow in is nominal, because you can't completely eradicate your exposure to toxins, but we've proven that you can do it significantly enough that your levels will drop.
Paul, I am certain this episode is going to be one of our most popular ones because it's so practical. We just filled so much great information in this time. And for those of you listening, Dr. Paul and their team at MDLifespan have created a landing page for my listeners. It's mdlifespan.com/Dr. Jill. On that landing page, if you go there, they're going to release this free book offer to you if you're listening. And more importantly, if you want to schedule a consultation, just a free intro call or a call with a doctor, you can go to that page and you can schedule a call right on that page. So I would recommend if you want to know more information or someone you love is suffering from mold toxicity, share this podcast with them, share this episode. There's no obligation, but I am a believer. I stand behind MDLifespan. I stand behind the integrity of Paul and his team. And that's why I'm so passionate about this. And most of all, just thank you, Paul, for your brilliance in bringing this into the world. And guys, there's another episode that's one of our top listed podcasts. If you haven't yet seen my other episode with Dr. Paul, just search on my Resiliency Radio for Dr. Paul Savage, and you can hear that other episode as well. Dr. Paul, thank you. Thank you most of all for just taking your heart and mind and your beautiful entrepreneurial spirit and creating this process procedure in a safe way to help those people who are suffering.
It's been my pleasure, always. Thanks, Jill.
You're welcome. Hey guys, wasn't that a great episode with Dr. Paul Savage from MDLifespan? As I mentioned in the end of the podcast, he is offering his free book, Avoiding Toxins, on my landing page, which is mdlifespan.com/Dr. Jill. So you can get that free book there. You can also schedule a free consult, actually 2 free consults, if you want more information and you're just not sure if this is right for you. There's no obligation. They do not pressure. So this is absolutely just to get more information. Most importantly, if you know someone that you love is suffering from mold toxicity or either autoimmunity, brain issues, cardiovascular issues, cancer issues, fertility issues, they have protocols for all of these things. I highly recommend you give them that link, mdlifespan.com/Dr. Jill, because they can do a free consult and get more information. And if you guys haven't yet subscribed, please join our over 820,000 subscribers on YouTube. Hit that subscribe button, hit the bell to be notified of future episodes. And as you know, we have new episodes coming out every week. So I will see you again next week on another episode of Resiliency Radio. Until then, be well.